Welcome back to Hearing Conservation. In this recording, we will discuss understanding audiograms. So the purpose of this recording is to recognize different types of audiograms. So topics included are understanding the role of the occupational hearing conservationist and characteristics of audiograms. So annual audiological monitoring is a critical component of an effective hearing conservation program. Monitoring includes the determination of air conduction thresholds for low, mid, and high frequencies. So the role of the occupational hearing conservationist. So this person ensures the validity and accuracy of the test results. This person is often tasked with obtaining pure tone thresholds at low, mid, and high frequencies by air conduction only. So the OHC must understand how to record and interpret audiograms because they are the medical legal document that is used to chart hearing status. So the OHC is also responsible for referring problem audiograms to the professional supervisor, who is an audiologist or a physician. The OHC must understand how to determine the existence of a standard threshold shift and recognize common patterns of different types of hearing loss. So annual tests are recommended for workers who are exposed to noise levels at 85 decibels on the A weighting scale. Workers are also required or recommended to have annual tests when they are exposed to ototoxins that are greater than or equal to 50% of the occupational permissible exposure limit. Thresholds can be plotted in a graphic format or recorded in a table. So to the left here is an audiogram, which is a graphic representation of how someone hears. On the right, we've got a depiction of a tabular representation of hearing results, which is what is more commonly used in hearing conservation programs. So because the occupational hearing conservationist will only perform air conduction testing, this person will likely use supraoral or insert earphones. And some advantages to using insert earphones include the prevention of collapsed ear canals. They provide greater interoral attenuation. They provide better attenuation of background noise, and they also allow for better infection control. Bone conduction testing is only performed by an audiologist on problem audiograms that were referred to the audiologist by the occupational hearing conservationist. So every occupational hearing conservationist, or OHC, reports to a professional supervisor, and that professional supervisor is either an audiologist or a physician. Okay, so audiograms can be classified by several different variables, including severity, location of pathology, configuration, modality, and symmetry. We often obtain thresholds at 500, 1,000, and 2,000 hertz to help us determine the severity of hearing loss. And we refer to that average of thresholds at 500, 1,000, and 2,000 hertz as the pure tone average. Hearing loss can also be classified as conductive, sensory, neural, or mixed. So conductive hearing loss is indicated when bone conduction thresholds are within normal limits and air conduction thresholds are not. Hearing loss is classified as conductive, can result from excessive earwax, fluid in the middle ear, fixation of one of the middle ear ossicles, disarticulation of the ossicular chain, or cholesteatoma. Sensory neural hearing loss is indicated when air and bone conduction thresholds are both outside of normal limits and are similar. Sensory neural hearing loss can be further classified as sensory or neural. A mixed hearing loss is indicated when air and bone conduction thresholds are outside normal limits, but bone conduction thresholds are better or lower than air conduction thresholds. A mixed hearing loss can result from pathologies in the outer and middle ear and pathologies in the inner ear. So there are different configurations or shapes to these audiograms. So we can have a flat shape or a sloping shape. And with sloping shapes, there's subcategories, and each one of these sloping configurations has its own criteria. Okay, so here's an example of a precipitously sloping configuration. You can see here that at 4,000 Hertz, it drops off very steeply. Here we have an example of a sharply sloping configuration where thresholds become worse by 11 to 15 dB with each octave. Here we have an example of a rising configuration where thresholds are worse at lower frequencies and get better with increasing frequencies. Notched configurations are those where thresholds are worse at 3, 4, or 6,000 Hertz, but are better at lower and higher frequencies. So the definition of an audiometric notch varies among investigators. And here I've provided you with a table with varying criteria used for detecting audiometric notches. We also have what's called a cookie bite or saucer-shaped configuration, where thresholds are worse in the middle frequencies compared with those in the lower and higher frequencies. We have a reverse cookie bite configuration, where thresholds are normal or borderline normal in the mid frequencies and worse in the lower and higher frequencies. We can also have our hearing loss differ in modality. So the hearing loss can be unilateral or it can be bilateral. We can also have symmetric and asymmetric hearing losses. We can also use multiple audiograms to further classify our patient's hearing. We can describe it as progressive when we can show that the hearing deteriorates over longer periods. We can describe it as sudden when we can show significant hearing loss occur suddenly. And we can also show that it fluctuates when hearing appears to become better and then become worse again over time. So in summary, data recorded on the audiogram is used to determine hearing status. Hearing test results can be recorded in a table or graphic representation. The OHC must understand how the data is collected and recorded. The OHC must understand the results of the audiogram, recognize problems, and know when to intervene. Hearing loss can also be classified by type, configuration, modality, and symmetry. All right, that wraps it up for this recording on understanding audiograms.